Hello and welcome to this presentation. Platform name is Blackboard Research and Foundation, and I will be your presenter today. Today I will discuss about visual acuity. So let's start it. Visual acuity is a term used to describe the sharpness or clarity of vision. It's referred to the ability of the eye to distinguish fine details and see small features of the objects. Visual perception involves the complex integration of several processes responsible for the interpretation of visual information received through the eyes, including the detection of light, form, contrast, and color. This process works together in the brain to create a coherent representation of the visual world. Visual perception is also closely related to motor skill, such as eye movement and hand-eye coordination, which help us to navigate and interact with the environment. Overall, visual perception is a complex and dynamic process that involves the coordination of several cognitive and sensory processes to make sense of the visual information we received. The perceived dimensions of visual object depends on their actual size and distance from the eye. Objects that are further away from the eye appear small than those that are closer, even if they are actually the same size. This is because of the size of their visual angle, which is the angle formed between the two lines of sight drawn from the eye to the two opposite edges of the object. Thus, the same object will have a smaller visual angle when it is further away from the eye, resulting in the smaller perceived size. Additionally, the size of object can be affected by other factors, such as the angle of the view, the size of the image on the retina, and the magnification of optical instruments. Uses. Visual acuity has several uses, including first number, assessing visual function. Visual acuity helps to evaluate a person's over visual functions and is an important component of the routine eye exam. Number 2, determining refractive status. Visual acuity helps evaluate the presence of several of refractive errors, such as nearsightedness, farsightedness, and astigmatism. Third number, measuring outcome of treatment. Visual acuity is used to measure treatment outcome of various eye conditions such as contrast, glaucoma, and macular degeneration. Number 4, medico-legal purpose. Visual acuity testing can be used in legal setting to evaluate the impact of visual impairment on a person's ability to perform daily activities such as driving or reading. Number 5, criteria for a person's fitness to drive. Visual acuity is an important factor in determining personal fitness to drive. Number 6. Eligibility for entrance into a profession. In some professions, such as aviation or law enforcement, visual acuity requirements are established for eligibility. Overall, visual acuity is an important measurement tool for evaluating a person's vision and ensure that he or she can perform essential everyday activities safely and efficiently. Component of visual acuity. The component of visual acuity includes: number 1, minimum visible resolution, the ability to detect whether an object is present in an otherwise blank field. Number 2, recognition, the ability to identify a visual stimulus such as identifying letters or symbols on an eye chart. Number 3, minimum discrimination ability, the ability to distinguish between two visual stimuli that are very similar, such as telling the difference between two letters that look almost the same. Number 4, spatial resolution, the ability to distinguish fine details in a visual pattern. Number 4, contrast sensitivity, the ability to distinguish between shades of grays or difference in brightness. Number 6, color vision, the ability to distinguish between different color. Number 7, stereo acuity, the ability to perceive depth and three-dimensional images. Overall, these components work together to determine a person's visual acuity and the quality of their vision. Factor affecting visual acuity. There are several factors that can affect visual acuity, including: visual acuity including: number 1, refractive error. Refractive errors such as nearsightedness, farsightedness, and astigmatism can cause blurred vision, which can affect visual acuity. Number 2, illumination and brightness and contrast and environment can affect visual acuity. Poor light can make object appear blurry or difficult to see. Number 3, eye disease or disorder. Eye condition like cataracts, age-related macular degeneration, and glaucoma can cause vision loss, which can affect visual acuity. Number 4, age. As people age, their visual acuity may decline due to change in the lens and other parts of the eye. Number 5, eye injury, abrasions, infection, or other types of damage to the eye can affect visual acuity. Number 6, medication. Some medication can cause blurred vision or other visual disturbance, which can affect visual acuity. Number 7, neural processing. Finally, the brain ability to interpret visual signals from the eye can also affect visual acuity, as the brain is responsible for processing visual information and creating our perception of the world around us. Overall, numerous factors can affect visual acuity and impact a person's ability to see clearly. Visual acuity is the ability of the eye to distinguish fine details and shapes object at a given distance. It is measured using an eye chart. The the result is typically exposed as a ratio. For example, 20 by 20 means 6 by 6 vision is considered normal visual acuity, which means that you can see an object at 20 feet. That is also means 66 meter. That a person who with normal vision can also see at 20 feet 6 meter. A person with 20 by 40 vision need to be 20 feet away from an object to see it as a clearly as a person with normal vision would see it at 40 feet away. Factors that can affect visual acuity includes refractive error, age, eye disease, illuminations, eye injury, medications, and neural processing. It is important to assess visual acuity as a part of a comprehensive eye exam to ensure optimum visual or overall eye health. Commonly used method for distant visual acuity. The most commonly used method for measuring distance visual acuity includes the Snellen chart and the logmer chart. The Snellen chart has standardized set of letters arranged in a row, typically viewed for 20 feet away. The logmer chart use a standard set of letters with each rows having a standard specific gap and each letter having standard level of visual difficulty. Both charts are using to evaluate a person's ability to discriminate fine details and sharp of object at a given distance. Other methods that can be used for measuring visual acuity include the doubling E chart and the landlord C chart. This chart or this test are often used in an eye exam and evaluate a person's visual functions and to detect any sign of eye disease or refractive errors. Herman Snell was a Dutch ophthalmologist who introduced the Snell chart for studying visual acuity in 1862. The Snell chart is an standardized chart that is used to measure a person's ability to discriminate fine detail and shapes of object at a given distance. Snell also devised a system of rating vision as a ratio, which is still used today as a measurement of visual acuity. Snell contributed significantly to the field of ophthalmology and is best known for his work on visual acuity testing and the chart he introduced. Principle of Snell acuity. Snell acuity is a measurement of visual acuity, which is a person's ability to see small detail and distinguish fine difference in shapes and contrast at a given distance. The principle of Snell acuity include: number 1, the Snell chart. Snell acuity is the measurement used to a standardized chart called the Snell chart, which display row of letters in decreasing size. The chart is usually placed 20 feet 6 meter away from the person being tested. Number 2, distance visions. Snell chart or Snell acuity measurement distance visions, which is the ability to see object clearly at a distance. The chart is placed at a fixed distance to ensure that the visual acuity measurement is accurate and comparable between different people. Minimum angle of resolution, that is part of a principle of visual acuity of Snell chart. Visual angle Snell acuity is based on the principle that smallest letter on the chart that can be reloaded at a distance 60 feet or 6 meter corresponds to a visual angle of 5 minutes of arc. This means that the letter subtends an angle of 5 minutes at the eye. Visual acuity score. Snell acuity is expressed as a fraction which represent the ratio of the distance at which the chart is viewed to the distance at which a person with normal vision can read the same line of the letter. For example, a person with 20 by 20 vision can read the same line of letter at 20 feet 6 meter that person with normal vision can read at 20 feet. So their visual acuity score is 20 by 20. Sinusoidal grating are pattern made up of parallel line or bar of varying brightness that are arranged in a sinusoidal waveform. This pattern can be used in various fields such as vision research, neuroscience, and optics. In vision research, sinusoidal grating are often used to study visual perception and the functioning of the visual system. The grating can be used to measure contrast sensitivity and spatial frequency training of the visual system, as well as to investigating how the brain processing visual information. The physical stimulus spatial pattern. In neuroscience, sinusoidal grating are used to study the receptive field of neurons in the visual system. By presenting grating of difference orientation and spatial frequencies, research can identify the preferable orientation and spatial frequency of individual neurons, providing insight into the neural mechanism of visual perception. The optics sinusoidal grating can be used as different grating to split light into its component color and analyze its spectrum. The grating specialized and orientation determined the different pattern it produces, and this can be used to identify the properties of the light source. Overall, sinusoidal grating are a versatile tools used in various fields to study and analyze visual perception, neural processing, and optics. That's all about the visual acuity. Today my topic. In this unit I will discuss another topic is intraocular pressure and tonography. Intraocular pressure or IOP is the fluid pressure inside the eye. It is measured in the millimeter of mercury mmHg. The normal range of IOP is between 10 to 21 mmHg, although it may vary depending on individual factors. The pressure is maintained by The balancing between the production on and drainage of aqueous humor, a fluid that nourishes the eye, and increases in IOP can cause damage to the optic nerve and lead to glaucoma, a group of eye disease that can cause vision loss and blindness if left under threat. Therefore, regular eye exams that include IOP measurement are important to detect and manage eye disease. Factor influencing the intraocular pressure. There are several factors that can influence the intraocular pressure or IOP in the long term and short term. Long term factors that can influence IOP includes: number 1, age. IOP tends to increase with age, and older individuals are at a higher risk of developing glaucoma. Number 2, genetics. Family history of glaucoma and high IOP can increase an individual's risk of depending the conditions. Number 3, ethnicity. Some ethnic groups such as African Americans have a high prevalence of glaucoma and elevated IOP. Number 4, medical conditions. Certain medical conditions such as diabetes and high blood pressure can increase the high risk of developing glaucoma and elevate IOP. Number 5, medications. Certain medications such as corticosteroid can increase IOP level. Short-term factor can influence IOP includes: number 1, physical activities. Expensive and physical activity can exercise and physical activities can cause temporary increase in IOP. Number 2, body position. Change in body position such as bending over or lying down can cause temporary changes in IOP. Number 3, eye drops. Certain eye drops such as those used to dilate the pupil or treat inflammation can cause temporary changes in IOP. Number 4, alcohol and caffeine. Consuming alcohol and caffeine can cause temporary increase in IOP. Number 5, fluctuation of intra-blood pressure. Sudden increase and decrease in blood pressure can cause temporary changes in IOP. It's important to note that these factors may not affect every individual in the same way, and some individuals may be more sensitive to the certain factors than others. Regular eye exam and monitoring of IOP level are important for individuals and risks of developing glaucoma or other eye condition. There is a type of tonometer. Basically, there are two types: manometry and tonometry. Tonometry and manometry are techniques used to measure intraocular pressure. IOP refer to the indirect estimation of IOP by measuring the deforming of the cornea or the resistance of the eye to a small force. While manometry involves direct measurement of IOP using cannula placed inside the eye. These techniques can be further classified based on the instrument used, the method of measurement, or the type of contact with the eye. There are several types of tonometry, includes applanation tonometry, indentation tonometry, non-contact tonometry, dynamic contact tonometry, digital tonometry. Contact tonometry furtherly divided into two types: indentation and applanation. Non-contact tonometry are available in air puff, pulse air tonometry. Indentation tonometry and applanation tonometry, there is a contact part of a contact tonometry. Indentation tonometry furtherly type divided in COs. Applanation tonometry, there is divided in variable force and variable area. That is, variable force means golden Parking's tonometry, and variable area is Makarov tonometry. Manometry, on the other hand, involves directly measurement IOP by inserting a cannula or needle into the eye, either through the cornea or limbus. This is considered an invisible produced and is a typical reversible for research or for cases where other methods or measurement are not possible. In summary, tonometry or manometry are techniques used to measure intraocular pressure, and they can be classified based on the instrument used, the method of measurement, or the type of contact with the eye. Tonometry is the measurement of intraocular pressure IOP within the eye. It is a diagnostic test commonly used in ophthalmology to assess conditions such as glaucoma. There are various methods of tonometry, including applanation, non-contact, and indentation tonometry. Applanation tonometry is the most commonly used method and involves flattening the cornea with a small, flat device while measuring the amount of force required to do so. Non-contact tonometry uses a puff of air to measure the pressure, while indentation tonometry involves applying pressure to the eye with a special device. The results of tonometry are typically expressed in millimeters of mercury, mmHg. Indentation tonometry is a method of measuring intraocular pressure within the eye. The method involves applying pressure to the eye with a small handheld device known as a tonometer. The tonometer is gently pressed against the cornea, which causes the cornea to inside slightly indent. The amount of indentation is then measured, and this measurement is used to determine the pressure within the eye. Indentation tonometry is typically performed after the application of topical anesthesia, eye drop, to minimize any discomfort during the procedure. This method of tonometry is often used in cases where applanation tonometry cannot be performed, such as in patients with corneal abnormalities or scarring. It may also be used to confirm the result of other tonometry method or to monitor IOP over time in patients with glaucoma. The Seuge tonometer. The Seuge tonometer is a type of indentation tonometer that is used to measure intraocular pressure within the eye. It was first developed by Hans Seuge in 1905 and is still used in some clinics today. Seuge tonometer consists of the weighted plunger that is attached to a graduated arm. The plunger is made of a material that compressed slightly when it is placed on the cornea, allowed for the measurement of IOP. The tonometer is placed on the anesthetic eye and the plunger is released, causing it to indent the cornea. The amount of indentation is read from the graduated arm, and this reading is used to calculate the IOP. Applanation tonometry. Applanation tonometry is a method of use measuring intraocular pressure IOP within the eye. It is most common and widely used method of tonometry in clinical practice. Applanation tonometry involves using a small flat device called a tonometer to measure the force required to flatten a small area of the cornea. The tonometer tip is typically sterile and then placed on the anesthetized cornea. A small amount of pressure is then applied to the cornea until it is flattened, and the force required to do so is measured. The force is then converted into the measurement of IOP in millimeter of mercury or mmHg. Applanation tonometry is performed over other types of tonometry because it is more accurate and less affected by corneal thickness and curvature. It is particularly important for the diagnosis and measurement of glaucoma, a condition that can cause damage to the optical nerve due to relevant IOP. Applanation tonometer is also used to monitor IOP in patients who have had ocular surgery or who are taking medication that can affect IOP. Commonly used tonometer are Goldman tonometry, Perkins tonometry, pneumatic tonometry, air pump tonometry, tonopens. There are few commonly used tonometer. Goldman tonometry, the most commonly used contact applanation tonometry, which is affects to most slit lamp system. Tonopen, a portable contact tonometer, also used for applanation tonometry. Seuge tonometry, based on the principle of indentation. This is one of the most widely used tonometry worldwide. Goldman applanation tonometry, the most commonly used tonometry in clinic that is influenced by various corneal morphological factors. Goldman tonometry. Goldman tonometry is a commonly used tonometer in clinics which is based on applanation tonometry and its effects to most slit lamp system. It is considered to be the gold standard instrument for measuring of intraocular pressure. It used a small prism to flatted a known area of the cornea and measure the force required to do so, which is directly related to the intraocular pressure. Note that a topical anesthetic must be installed before the measurement is taken. The Goldman applanation tonometry is a device used to measure intraocular pressure in the eye. Here are steps for the performing the Goldman applanation tonometry technique. Number 1. Being by ensure that the patient is seated comfortably and their hand is in stable position. Number 2. Topical anesthetic drop are applied to the patient eye to number them. The tonometer prism is cleaned and disaffected before used. Number 4. Align the patient eye with the tonometer and adjust the microscope until the cornea is in focus. Number 5. The tonometer prism is gently placed on the central cornea. Make sure that the patient does not blink during the process. Number 6. The examiner adjusted the tension on the tonometer until two green semicircle are seen, with the edge just touching each other. This indication that the pressure on the cornea is 10 mmHg. Number 7. The pressure on the tonometer is increased in 1 mmHg increment until the examiner see two semicircle just touch again, indication the intraocular pressure of the eye being tested. 8. The process is repeated for each eye. It is important to note that the Goldman applanation tonometry techniques require a skilled operator and can be influenced by factors such as corneal thickness and hydration, which can affect the accuracy of the measurement. Additionally, it is important to take multiple measurements over time to account for any variation and so establish a relief baseline measurement.
Thank you for watching my video.